The great thing about running and why I've always adapted to it, because it always has a start and a finish, and only I'm responsible for the outcome of that. With my knee pain, it became more of just an issue or uncomfortable without running. So whether if I was sitting or walking, when wasn't even training or running, I had knee pain, and that was in my left knee. I'm 47 years old, and with my age, I was kind of, the doctors I saw before Dr. Tao, I was being informed that it was probably best that I stopped running, start to think about retiring and possibly cycling.
Well, Cray had a pretty tough knee when I first met him. You know, he had arthritis on the outside of the lateral side of his knee, and he had been dealing with it for a long time. And so he came in, you know, basically looking for a way that he was going to be able to keep running and stay active, and wanted whatever solution he could find to do that.
Seeing a doctor that had passion for understanding what the patient was like, and when I saw Dr. Tao and I got to meet him for the first time, Dr. Tao wasn't aware that I did run. And I wasn't seeing him with the intention of getting back to running. And I needed more of a kind of a doctor to understand me a little bit and be patient and listen to my story, and Dr. Tao did that.
The knee replacement is for sure the most definitive thing for him, but nobody's going to be excited to let you run on a knee replacement, whether it's a partial or a full replacement. And so the only other really reasonable option, I think, that would kind of address his problem and also allow him to stay active was considering something called an osteotomy. What the osteotomy is basically is we make a cut through the bone at the end of the femur there and actually spread the edge of the bone apart, almost like, you know, opening a jack for a car jack to try to lift it up. And what that does is then realigns the joint for the knee. And so instead of having a bunch of stress to the outside of his knee where he has arthritis and pain, it reshapes or realigns the knee so it's going towards the middle part of his knee.
My knee was bone on bone. I couldn't walk, I couldn't run, I couldn't train like I was used to, but hands down, without the surgery, I wouldn't be able to run as far and perform like I do now. So it's given me a new opportunity. People that know me, I don't really love running. I don't have this fascination for running, but the thing is I can do it. And because I can do it, it gives me this new perspective, and it pushes me, empowers me to go further than I ever have before.
From a surgeon standpoint, we need to tailor the approach of what we do to an individual patient's needs. You know, we're big on that here. We believe that it's a team approach to care, and that surgery is just part of it, but the rehab and how we manage people, we want to put a team around you that's going to get you back to being healthy and active.
Me even running 1 mile or 5 miles or 10 miles or 100 miles wouldn't be possible without the surgery. That's a fact. It's not this new lease, it's this new perspective and this new growth. So running faster and further, I would never have imagined it before the surgery.